Dr. Paul, we have got some sick kids for you guys to look at. This is something else. Hello. Looks like you got sick kids.
Yeah.
Oh my goodness. Yeah.
So they've been diagnosed with croup. Last night we went to the urgent care and we got the first steroid shot, steroid dose in their mouth. But they're still, especially my little guy Anthony here, really not doing very well. So we're pretty concerned. Just want to make sure they're okay. He's just miserable.
Yeah, you can tell he's miserable.
Yeah.
This amount of congestion that I'm seeing right here, I mean, just so congested. Folks, I already took a preview here. I knew they were sick, so I zooped in and took a listen. But basically, I'll double check, but I was not hearing anything of concern.
In the lungs.
Other doctors probably go, how can you hear? When they take a deep breath, they stop crying. So there's, and you can hear, and the lungs are clear. And that's surprising when you look, you think, oh my goodness, we just got a faucet of nasal discharge and obviously feeling miserable. At this age group, this is less than 1. A couple twins here who are infants with this much congestion, and you'll start to get a mucousy cough. It's probably bronchiolitis. So that will give you a lot of secretions, a little bit of wheeze, and a mucousy sticky cough that kids get worse for the first few days to a week, and then they level off for that next week, and then they get better over the next couple weeks. Hey buddy, I know you've got a lot to say. You're not feeling very good, huh? I know. It's terrible. You feel a little better having brother right next to you. All of a sudden, it's like, wait a minute. Croup is more of tends to be the slightly older kids with a barky, dry cough. And they'll make a raspy breathing sound like that. That kind of thing. I'm pretty sure they have bronchiolitis. It's usually RSV. So we're going to swab their noses, folks, and check for RSV. But because there is a little bit more pertussis these days, we're going to go ahead and swab for that as well. So that's whooping cough. The pertussis test takes a day to come back. The RSV will know right away in the next 15 minutes. And they responded, all of them responded really well to Decadron, which is a steroid. Can be given by shot or orally. So we're going to go ahead and give them a dose of Decadron as well. So you'll see that as well. And then we'll kind of wrap it up with the plan. Thank you so much. I've already looked in their ears. Their ears are okay. One had a little tiny bit of fluid, but they're otherwise not red. And their lungs are clear.
It's okay.
Very unhappy, obviously. And Super Mom here. You guys are going to have to give some major thumbs up for Super Parents, letting you in on just, oh man, can you imagine having 3 young sick kids at once? Been there in the past, but God bless you for being able to handle this.
We'll take the prayers.
I think you have to be young to handle this. So anyway,
Negative.
So no RSV, so that's good. So I will go find Doc and let him know, and then give Mom a call.
Thank you. Thank you, nurse lady.
as you can see, the RSV was negative. These amazing twins have recovered completely from this illness. I just saw them recently and they're doing wonderfully. We also had checked the pertussis, which came back negative, which was a good thing. Whooping cough is not a good thing for little kids. And yeah, so you got to see some sick kids who recovered beautifully. We were sort of figuring out, is this croup, is this bronchiolitis, and sort of figuring all that out. Sometimes you can have both. But I think in this case, it's certainly a viral upper respiratory issue with a little bit of stridor, that's your croup, and the expiratory wheeze, that's your bronchiolitis. And they recovered beautifully. We did not have RSV, we did not have pertussis, so it was a different virus triggering this, often para-influenza or, yeah, long list of possible viruses. Thanks for watching. I'm Dr. Paul.
Fantastic.